Village Opco International welcomes you to Community Health Volunteer Training Module 1. Health and Development. Objectives. Our objectives in this module are to help you understand the relationship between health and development in the community, understand the Kenya Essential Package for Health and Community Health Strategy. In this module, we shall have two lessons: Community Health and Development and Community Health Strategy. Let's start with Lesson 1, Community Health and Development. Our objectives in this lesson are to describe our vision of health, to describe the relationship of health and to development. Number 3, to describe the right to health, and number 4, to describe the partnerships. Let's start with section 1, vision of health. What do we define health as? Health is the optimal state of mental, physical, emotional, and spiritual well-being. Health is more than just absence of disease. We want our community health volunteers to be advocates for the vision of health. From Kenyan Community Health Service, this vision is healthy people living healthy and quality lives in robust and vibrant communities that make up a healthy and vibrant nation. So why are so many of our people not healthy? Most people don't know that clean water, good hygiene, good food, child spacing leads to good health. What environmental health problem do you recognize here? How can our people learn to live healthy lives? As a community health volunteer, we get help through health promotion and community development. Section 2. What is the relationship between health and development? Promoting health means more people can contribute to developing our community, and sound community development helps us better promote good health in people. For example, latrine promotion. Improved community life leads to happier, healthier people. Facilitating access to health care services. Improved community life leads to happier health people. And hygiene, education, and help people live happier and healthier lives. So, what are these factors of health and development? First of all, let's look at factors that promote health and development, and this includes infrastructure, which are roads, electricity, schools, and hospitals. We have partnerships, that are non-governmental organizations, community-based organizations, faith-based organizations, and government departments. Human capital, which is education, health services, and safe environment. Basic human needs services, these are shelter, social security, and community welfare. We also have taking initiative. We also have the problem-solving skills. We have democracy and leadership, regardless of gender or age. We have creation of employment. We have community capacity building, which improves knowledge and skills. We have community participation, disaster preparedness, and safe environment. We also have fair relationships, personal hygiene. Let's go to factors that hinder health and development. This includes poverty, which is lack of resources and unemployment. We have dependency, whereby large family size with only one or two breadwinners. We have lack of initiative. We have lack of advocacy, which is one's rights and rights to the community. We have cultural beliefs, that is harmful and outdated cultural practices traditions, and attitudes. We have lack of knowledge and skills. Unavailability of quality fertile land, whereby people are not able to carry out their economic activities such as crops and dairy farming. We have poor infrastructure such as poor roads networks that hinder access to health services and also hinder farmers from accessing markets to sell their produce. Political environments, which is poor leadership and poor policies. We have corruption, which leads to lack of transparency and accountability. We have natural and man-made disasters, diseases, insecurity. Let's go to section 3, which is right to health. Health is a basic human right as provided for by the Kenyan Constitution. Every individual, family, and community can advocate for health. Afya yetu jukumu letu is a slogan for the Kenyan's community health strategy. Let's go to section 4, which is partnerships. What are partnerships? Partnerships are individuals or institutions working together to share resources, ideas, specialties to achieve their common goals to better than they could have done individually. Vision of partnerships in improving community health. When communities come together, schools succeed, neighborhoods are safer, crime shrinks, and people can achieve higher potential.